Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Thank you for viewing today, and I think that we have an exciting topic to talk about today. Today is the third part of our series regarding things regarding the cranial area of your head. The initial part of the series, done a few years ago, was devoted strictly to headaches and headache syndromes and using natural treatments to help headache syndromes. Our other component was we did a show on cranial manipulation and how soft tissue manipulation of the face and cranium relate to different head and facial disorders. Today, we're going to take on specific topics and specific diagnoses that are within the cranial area that people get and need treatment for, but is not within your mind, like not within your head or cranial vault, as it may have been with headache syndromes. The first thing I want to discuss today is something called occipital neuralgia. Occipital neuralgia is a common condition upon which people will experience either pain, numbness, tingling, or symptoms in the back region of their head. Now, most people are under the assumption that when they're experiencing symptoms into that area, that there's the nerves coming out right from your head into that. There's no nerves that innervate the posterior portion of your head that don't come out from between the base of your head and neck. And that's called the occipital nerve. That's a nerve that exits out of this region up into here and then can influence pain, numbness, tingling, and the sort into there. When we get to the second half of our show, we're going to talk about treatment options for this condition as it responds readily to natural therapeutics. The next condition that I'd like to talk to you about, which is something that we see a significant amount of, is something called trigeminal neuralgia. Trigeminal neuralgia is a very large cranial nerve meaning a head nerve that comes out between your jaw area. This nerve is broken into three different divisions: the mandibular, the maxillary, and the orbital division of the trigeminal nerve. This nerve can be influenced by mechanical problems, such as a person having temporomandibular joint disorder. It can be caused by viruses, or your person could have a cold or have a direct injury to that nerve. But what frequently will happen is that a patient will experience numbness or tingling, pain along this margin, symptoms inside of their mouth, numbness in this component into here. They'll also get pain that radiates up into the temporal area. It's a common disorder that we see and treat, and we're also going to demonstrate how that can be affected through natural therapeutics. The other thing we're going to discuss is something called facial neuralgia. That's something that's caused by trigeminal nerve is your fifth cranial nerve. The seventh cranial nerve is your facial nerve, and that's one that can cause muscle drooping. It can cause fasciculation of muscles in and around the eyes, into the forehead, cause a lot of adjunctive symptoms. And what people will experience is something called facial neuralgia. So we're going to discuss how that can be influenced with the condition. We see a lot of that now because what happens is that frequently when patients get Lyme's disease, they'll have facial neuralgia where their facial muscles will drop, and that can frequently be triggered off through having Lyme's disease. So we're seeing an increased incidence of this condition. Something that I see and treat a lot of, and that's a personal pet issue of mine, is that Shingles is a virus that lies dormant in the nerve endings of the cranial nerves, and those that they lie dormant in the nerve endings of the spine. These are a virus that this is a virus that can come out just similar to a like a cold virus, and that cold virus is one in which then it creates skin eruptions on the surface of the skin. It's common for people to get in and along their rib margin, into the arms, or down into the legs or into the buttock areas. Having these forms of eruptions are not only painful, but it's something that can be remediated pretty quickly naturally. Sometimes when it's out in the periphery, it'll get better by itself normally. But when it attacks the cranial nerves or the nerves in your head, sometimes this can cause permanent facial disfigurement and create chronic pain syndromes that can last for significantly long periods of time. So natural therapeutics is one that has a good and long-lasting effect on that condition. Okay, so that's something that we're also going to address. The other thing that we're going to look into today is the treatment of TMJ syndrome, or temporomandibular joint syndrome. Common occurrence is frequently seen by jaw joint specialists and dentists. People will experience pain upon biting down, or they'll have pain in and around this joint right here. Your jaw joint fits into this area right here, and when you open your mouth up, what happens is that the jaw joint isn't strictly just a hinge joint itself. The jaw joint is one in which is a gliding hinge joint, one in which when you open your mouth up, it slides into another groove. The cause for a TMJ joint problem may be the fact that this disc or this cartilage pad that normally rests in between there can shift and make it so that when a person opens their mouth, they get a popping, clicking, a painful experience just through opening or closing the mouth because of that disc shifting into there. The other reasons may be the influence of abnormal tension on these muscles that relate to the TMJ joint. This is the masseter muscle here. The masseter muscle is the strongest muscle in the body, and it's one in which delivers tremendous amount of force in compression down. So what happens is that when people grind their teeth at night, they put so much tension down on this area because this muscle is so strong that they start to wear their teeth down, and they can disturb the nature of this joint. So natural therapeutics can frequently reset the tension of this joint and the pterygoid muscles, which are muscles that are up on the inner portion of the mouth that influence and guide the way that the pull of this jaw joint is. So temporomandibular joint is something that we also see and treat. We treat it using acupuncture. We treat it using cold laser. We treat it using manipulation. We treat it using soft tissue manipulation of these structures involved as far as the muscles involved. Frequently, we'll give people night guards that they can use when they're sleeping, so that if there are a person that clenches or bites, it helps to take the pressure off there. But that jaw joint is intimately related to that cranial nerve, the fifth cranial nerve, and boy, that can bring a tremendous amount of pain on for people. So these are things that I'd like to evaluate today, talk about, and demonstrate, and stay with us. With me today is Miss Jenna Ryberg. I've known Jenna for the past 8 years. She has worked in my office for 4 years throughout the course of her high school. She's just recently graduated from the University of South Carolina and has a degree now in advertising and in media events. And she's just entering the workforce. If there's anyone out there that's looking for somebody that's highly motivated and works hard and is smart and is a marathon runner, and this is the person. But today, she's also going to be working with me as my demonstration model as we work through some of these problems that we were talking about. When I was mentioning, what I started out earliest with today was a condition known as occipital neuralgia. Frequently, the people don't realize that symptoms that they can get at the base at the back of their head are frequently caused from injury or something occurring between between their occiput, which is the base of their head, and their first neck vertebra. So what happens when a patient comes in and presents with these symptoms, we will do an examination consisting of range of motion into this area. We'll do motion palpation to see, and we can usually, if a person has occipital neuralgia, isolate the exact point that reproduces that radiating pain and symptoms. Once we've determined causation, whether we need to do imaging such as MRI or X-rays, once we've determined what that is, then we go about treating that condition. We may use cervical decompression. We may use different forms of home traction for the patient. We may also, this can also be the cause of some people having something called suboccipital headaches. Many times people will have headaches that stem from between the base of their head and neck, and it feels like a knot or like a half of a golf ball on the base of their head and neck. So what we do is we palpate into that area, and frequently we find fixation or a locking up of the joints into that area. So there's many different treatment modems, whether we're using ultrasound, muscle stimulation, traction, or acupuncture to release the musculature into this area. These are all things that modalities that we would use to help heal this condition, and it's something that is conservatively treatable the majority of the time. Something that I'm going to demonstrate in just a moment is temporal mandibular joint syndrome. Very, very common. Basically, people will get it through either biting down hard on something, or they clench their teeth at night and put abnormal pressure, and they create an inflammatory process that goes on into this joint. Sometimes even stress and tension and frustration, causes some people to clench and hold into this area, and it creates dysfunction. So what happens is that we do an evaluation of the joint that, number one, is going to check the range of motion of the joint, open up, Jenna, and close, open and close. Okay, open and close. We can also feel that through the ear, open and close. Frequently, people will be very, very tender on they can have pain on both sides, but usually they're more tender on one side than the other, and they'll have a lot of pronounced joint tenderness, a muscle tenderness in that masseter muscle I was showing you on the chart before. So since this is a common condition that we see and treat, I'm going to demonstrate to you some of the acupuncture treatment modems that we would use right now for the condition itself. Jen, let me have you come just lie right on your back for a moment. Now, first we're going to do some needling of what would be considered to be local points for acupuncture. Local points are points that influence the condition that are in and around where that problem is at. Now, all of the needles that we use for acupuncture are single-use disposable sterile needles. So what we do for this condition is that each individual condition is treated slightly different with the presentation that the patient comes in with. But there's certain points that we would needle. We would always needle those points on people because there's so much efficacy, meaning there's so much. The majority of people respond to needling at that point, so that's what we do. So one thing that we're going to do is use acupuncture needles to release the masseter muscle. Now, when a person has the condition and it's very pronounced, that muscle and that joint may be very tender. So sometimes it's slightly tender when we initially needle into this area. And then what happens is that a person feels a tranquil sensation come over their body. Open up and close. Usually with the condition, what happens too is that when we look at a person's teeth, they'll deviate as they open and close their mouth, along with what may be a popping or crunching that they may experience. Frequently with TMJ joint syndromes, we're actually treating both sides of the body, not just the involved side, because we want to create a balance between one side and another. The secondary thing that we do is something called auricular medicine. Auricular medicine is a secondary form of acupuncture that deals with a microsystem of acupuncture that deals with stimulating the actual cortex within the brain stem itself that influences the fifth cranial nerve and the way that nerve functions in the body. Okay, so there's normally about 4 or 5 points that we would be getting into the ear. There's usually 2 to 3 points that we would be getting bilaterally. Then separate from that local treatment is something that's within acupuncture is called distal treatment. Distal treatment is where these are points that are far away from where the condition's at, that influence up into there and have, over the period of time, have proven to be efficacious for the treatment of the condition. Now keep in mind, I'm just showing you the treatment on one side of the body, and normally this treatment would be going on simultaneously on both sides. In the case of severe TMJ joint pain, in which the patient actually has locking of the jaw joint, sometimes they can barely open up their mouth enough, what we'll do is that we have instruments where we will put a mild electrical current throughout the course of these needles that will accelerate the acupuncture process itself. For some of those people that are needle shy, what we use is we have an acupuncture laser that we can use for people that just, needles aren't their cup of tea or not going to go in that direction. But it's one in which we treat the majority of time with sterile acupuncture needles. We back it up with using the cold laser into the TMJ joint, and what the cold laser does is it draws out inflammation. It increases the rate at which nerves heal, and helps to promote the healing of soft tissue in and around the involved area. Something that we would also do for the condition is that just like the spine can be adjusted chiropractically, we have chiropractic adjustments for the spine, there are manipulations of the jaw joint itself, and I'm going to just demonstrate that for you in a moment. Okay? Now the deviation, open up once again, Jenna, and close, open, and close. Her jaw joint's actually pretty darn good, so we're not going to actually apply the force in for the treatment, but I'm going to show you the setup involved in the condition itself. One is that we're going to locate where the dysfunction is in the joint, and open up just slightly, and the force is going to be applied down to normalize the pull of the actual jaw joint itself. There's times where we'll come internally, and what we'll do is we'll actually put pressures on to shift the position of that disc in throughout the course of the neck. Okay. Frequently, when I was talking before about the occipital neuralgia causing the radiating pain and symptoms in here, that all occurs all at the base of the head and neck, and it's something that you can respond very readily chiropractically, just by putting a little pressure and moving the involved region. Go put a little pressure right here, Jeff. Okay. Now, that might look vigorous, but it actually feels very good as the joint supply opens up into the involved area. Now, so what we would also do is for the TMJ Joint Syndrome, as I mentioned before, frequently we're going to give the patient exercises to do at home. Usually most people respond very quickly. If it's a clenching thing, it can take a longer period of time, or if the condition is really advanced, then we would do some imaging that deals either with a CT scan or an MRI of the TMJ joint to see whether there's any anatomical damage that can occur that occurs to the joint that would go beyond the nature of conservative care. But this is something that we see and treat quite frequently. Now, the trigeminal neuralgia. Now, that trigeminal nerve is a big cranial nerve coming out from this area, and this is where we see the people coming in, and they have either radiating pain, numbness, or tingling into here. Sometimes they'll have deviation of the function of their tongue, where their tongue will feel thick on one side, or they'll get lip swelling. Other times we'll get pain and symptoms into this region or up into here, and that will give us indication of what portion of that cranial nerve is involved. We would do needling techniques that go along the portion of the nerve, along with the distal treatment involved. The treatment takes roughly about 45 minutes. Usually most people that come in with that condition get anywhere between 4 and 8 treatments, with the average being 6. But it certainly is that's when we take all of the cases of this that we treat across the board for that. Something that I wanted to demonstrate to you before that I didn't talk to you also, that I didn't mention earlier, is that frequently people now suffer from chronic sinusitis. And in the absence of continuous infectious processes, they have this, it's either due to allergies, a low-grade immune response, or some type of dysfunction in the way in which the sinuses are. So we use acupuncture to help treat chronic sinusitis, and I'm going to demonstrate that to you right now. There's distal portions of the treatment that we do to, number one, enhance the immune system in regards to treatment of chronic allergies and chronic sinusitis. So there's two components. One is that we're enhancing the immune system, and the other is that we want to give symptomatic relief of the involved areas. Sometimes people come in and they've just been suffering. They're taking, pharmaceutical medications. They're on, constant regimes of antibiotics and never seem to get any better. And doing acupuncture along with Chinese herbal medicine for this condition frequently remediates the condition in totality. Now, with the treatment of chronic sinusitis, it's slightly different. In that we're actually treating into the sinus regions in the frontal sinuses. And no matter how blocked up someone is, when they leave the office, they're going to be breathing. Now, these are all what we consider to be local points, because frequently, most of the time, people will get these frontal sinuses up in here. We will either have patients do nasal washes along with doing some nutritional recommendations. There's about 4 to 5 points that go into the ears that also deal with this subsystem of auricular medicine that helps to enhance the immune system. For many people, it looks like this would be something that hurts. Actually, it doesn't. It's very tranquil. After just a few minutes, the patient has a very, very tranquil sensation go over their body, and they feel very, very calm and sedate throughout the course of the treatment. It's a lot different than what people think when they come in. But it helps to shrink the sinuses, decrease the inflammation, enhancing the immune system through the distal points, re-educating the nerve supply through this whole aspect of doing the auricular medicine that deals with the ears itself, that subsystem of acupuncture. Now, something I wanted to call reference to before, that is one of my pet topics, is people will come in and they will have that shingles virus, and what happens is that they will get an eruption, what feels initially just like a pain, and that will come onto into a singular area, and then after a few days they'll usually go to the doctor because they'll see the eruptions come out along that nerve pattern, and once that occurs into there, then it's very, very painful. And it's something where the reason for getting treatment for it, acupuncture-wise, especially in the cranium, is that people can develop chronic pain from having it in a facial nerve, and they can develop chronic scarring as a result of having the condition. So nobody wants, long-lasting scars on their face as a result of this virus. So by getting acupuncture, it helps to accelerate the rate of healing for those cases in which it wouldn't be healing its own. This was a technique that I learned from a Korean man, and who specialized in doing treatment for shingles virus. And what happens is that normally, if the pain area is in here, we'll use needles, and what we're doing is we're actually weaving the needle underneath the scalp in a manner that influences all of the nerve supply into the adjunctive region. So it wouldn't be uncommon for us to be, if the involved area was here or here, we would be using 10 to 12 needles into that area. And those are woven into the nerve patterns, predominantly isolated by where the palpatory pain area is. So this is a very, very good technique. I don't find that prescription medication works very good as far as the shingles virus is concerned, and I recommend to anyone out there that when they have a diagnosis of that they start to take lysine hydrochloride. Lysine hydrochloride is it's an amino acid in a hydrochloric base. It is available without prescription, and what that amino acid does is it helps to prevent the replication of that virus, and also they have much accelerated rate of healing with the condition. Okay. Now, what I was mentioning before with the patients with the Lyme's disease and patients that develop they develop a facial drooping, eye drooping, tic Delarue. These are all, conditions that are dealing not just with pain, but in dysfunction of the facial muscles. There's treatment that we do where we're actually using a combination of laser acupuncture and needle acupuncture to stimulate an anti-inflammatory response and reset the tonicity of the muscles. Now, in the past, when I was demonstrating to you where we were doing an acupuncture facelift, and that's on the website if anybody wants to see that. Well, some of the techniques are common, in which we'll do needling techniques that reset the spindle cells within the muscles of the involved facial region. What happens is that when people get these chronic areas of pain and tension, that we can relieve it, but then they have a tendency of coming back. The value of acupuncture is that it can reset the control mechanism of the tension set in the muscle to get for a nice even keel and pull of the involved area. So keeping in mind, when a person has facial symptoms, sometimes it can be caused by teeth problems, things like that, things that need to be sorted out by the dentist, or ocular problems that need to be sorted out by the ophthalmologist. But many times there's a whole host of musculoskeletal problems that can be treated within natural health care, using physical therapeutic methods. For Natural Healthcare Alternative, I'm Dr. James R. Golding, and thank you very much.